Okay. So a couple of, I think one housekeeping thing that I was thinking about. So 8% is, wait for Joanna to come on board here. Give me a second. Okay. So last week or 2 weeks ago, can't remember exactly when, but they had an 8% road show here in Naperville, and I bought some group tickets. I bought 20 premier tickets for anybody who wants to go. So these tickets are valued at like I think like they say $800, and then they have a sale, blah blah blah, and that. Anyways, there's some pretty good tickets. If somebody wants to go, I got a ticket for you. I have a ticket to the event. If you want to go, you just have to make your way there. You have to make your way there and get lodging and all that stuff. So 8% is going to be July 28th through the 30th in Dallas, Texas. And this is where it's going to be held at the Hilton Anatoly Hotel. Okay, so I got 20 tickets. So the first 20 that say that they want the ticket and they want to go, I'll set your ticket aside, and once they're gone, they're gone. If you want to go, then you got to buy your own ticket and make your way there, right? So again, somebody wants to go to this thing, I got a ticket for you. You just have to make your way there and get a hotel or get an Airbnb there. Okay. I've said this plenty of times before. The first time I went, it really changed my outlook, like the view I had about my business. Not because of the speakers are great, they're amazing, and you're always going to get one nugget from each and every one of the speakers, which is amazing. But just hanging around people who are really doing stuff, just hanging around people who are really like kicking some butt and making millions and millions of dollars, and having conversations with them at lunch or at dinner or over drinks, and their willingness to share what they're doing in their business is probably the most valuable thing about going to these conferences. So there's a million of these conferences going on. I try to go to as many as I can, because every time I go, I pick something up, and it's just really helps my business. If there's one that you're going to go to, or if there's only one that you can go to, I'm gonna tell you to go to 8%, just because how it affected me a couple of years ago. Okay, and then maybe next year you want to go to 2 or 3 or whatever it is that you want to do. I'm just telling you, I got your ticket. I got 20 tickets. Whoever wants to go, let's ride. You just got a plane ticket and find a hotel room. Okay. Does anybody have any questions about this?
No. Carlos?
Yep.
Yeah, I just put in my note there in the chat. The Marisol and I are in.
Okay. Okay. Fantastic. So now I got 18. I got 18
There you
tickets. So again, think about it hard. If you guys want to go, let me know. Okay. You can go to Google, check your flights, and check hotels here. What I've noticed is that Airbnbs tend to be, well, my friend Tatiana says that Airbnbs tend to be a little bit more affordable than the hotel. So don't be afraid to check those out as well. Okay. So today I want to go over just some Medicare 101 refresher, because I noticed that when I did new agent training last week, and there was a few new agents and a few, veteran agents, I noticed that a few of them were just kind of were surprised by some of the stuff that we talked about in our Medicare 101 piece. Okay. So I wanted to go over, my Medicare educational seminar slides. And if you guys have any questions, stop me. Let's talk about it. This is going to be recorded so that any new agent that needs it, they can go back and look at it. Okay. So let's put it all up here. Pull it all up here. Okay. So we're going to talk about enrolling into Medicare, exposures to Medicare, the Medicare savings program, and your Medicare choices. Okay. So who is eligible for Medicare? Okay. Anybody who has legal status here for 5 years and is over 65 years old is eligible for Medicare. Okay. So if you have a grandma or grandpa that came in, 10 years ago and they finally got their green card and they have their 5-year anniversary with their green card, those folks are eligible for Medicare. Okay. Who's eligible for premium free Medicare are the folks who have worked here all their life. Everybody on mute. Can you hear me okay? Okay. So the people who are eligible for premium free Medicare are the folks who have worked there at least 10 years of their life, paid into FICA taxes, and earned their Medicare credits. These are the folks who get premium free Part A. Okay. There are basically 4 groups of people that are eligible for Medicare. Okay. The folks who are turning 65 years old. Okay. That's obvious. The folks who have been collecting Social Security disability for at least 24 months, for 2 years, they automatically become eligible for Medicare. Okay, you don't have to be 65 years old. People who have certain diseases like ESRD or ALS, like Lou Gehrig's disease, those folks kind of automatically become eligible for Medicare. Okay, and this one's a little weird, but it's true. The people who are coming off of a group policy, people who are working past age 65, they delayed their Medicare, now they want to retire, and now they're eligible for Medicare. Okay, anybody have any questions about these groups of folks who are eligible for Medicare? Anybody have any questions about, how you earn your credits? Okay.
I have a question.
Go ahead, Veronica.
How do you apply for Medicare due to disability? So someone calls me and they say, I'm on my 24th month of disability. What do I do? So I send them to Social Security. I tell them, you need to call or go to Social Security office and tell them that you've been on disability for 24 months. Is there anything more that we can do for them?
There is something wrong there, because what do we know about people who are collecting Social Security disability?
It might be not disability. It might be something different depending on what day they're receiving their benefits. But we need to make sure, like if it's a true disability for 24 months, then.
Okay, but what do we know for a fact? When somebody is collecting Social Security disability, what happens automatically?
When they turn 65, they get their card.
Nope.
But
nope. When somebody is collecting Social Security disability for 24 months, they automatically get Medicare. There's nothing no one has to do. They automatically get enrolled into Medicare Part A and B. So if they didn't get their card 3 months before they turned, they became 3 months before their 2-year anniversary, then what do we know? It's not Social Security disability. They have something totally different. Does that make sense?
So they actually get it automatically in this case.
They get it automatically.
Okay, I didn't know that.
Yeah, if they didn't get it automatically, then guess what? They're not collecting Social Security disability. That makes sense? It's likely supplemental security income, which is not the same. Okay. So that person, if they didn't get their Medicare card, and you know they're collecting Social Security disability, then what are you going to do? You're going to call one of the carriers with all the client's information, their Social Security number, and say, listen, I want to enroll the client into a Medicare Advantage plan, but I don't have their Medicare number, right? Okay, they're going to ask you for their information, their social, their address, and if there's a Medicare number that appears that exists in the universe, they'll give it to you. If it doesn't exist in the universe, then guess what? They don't have Social Security disability. It's something totally different. That makes sense?
So maybe they have the Medicaid number. Is that?
No,
No.
nothing to do with it. We're trying to figure out if they if why she asked, how do you direct somebody to get Medicare if they're collecting Social Security disability and 24 months and they've had it for 2 years? You don't do anything. They get it automatically. There's nothing you're supposed to do. And if they didn't get it automatically, because you've called and you verified that there's no Medicare number in the universe somewhere, then you know for sure that it's not Social Security disability income, that it's something totally different. And they have to be on ACA or any other health insurance policy. That makes sense?
So what's the difference between MMAI and the disability? Or not the disability. Are these disability people automatically enrolled in state or
No.
Disability.
MMAI is for folks who have Medicaid and Medicare at the same time in states that offer MMAI plans, but that has nothing to do with Social Security disability. I can be making good money and still collect Social Security disability income. Does that make sense? Like I don't have to be at a very, very low income to collect Social Security disability income. Somebody was working here for many years, and then somehow they became disabled, and now they collect Social Security disability income. Make sense?
Okay. Thank you.
Okay, so one thing you guys want to know, sometimes folks, like immigrant folks, they're over 65 years old, and maybe they only have 8 years worth of work history, and they only have 32 credits or whatever the case may be, and they're wondering, should I continue to work? Should I continue to work to try to get my Medicare credits? Does anybody know how much somebody has to claim on their taxes to get the 4 credits? Does anybody know?
6,000 something a year.
That's right.
Yes,
That's right.
6,000.
So so it's about $6,000. We'll look it up later, but it's about $6,000. So if somebody wants 4 Medicare credits in 1 year, all they have to do is pay taxes on $6,000, and that's it. Medicare will give us the 4 credits that we deserve. Okay. All right. So how can we enroll into Medicare? Okay. Couple of ways. If we are already on Social Security, you'll automatically be enrolled. We know this already. If somebody's already retired, maybe they decided to collect Social Security at 62 years old or 62 and a half, right? Or maybe if somebody is on Social Security disability, right? If you're already on collecting Social Security and you're turning 65, you're automatically going to be enrolled. There's nothing you have to do. 3 months before you turn 65, you're going to get your Medicare card in the mail. And if you don't have it in the mail 3 months before, then you lost it somewhere because it's automatic. Okay. If you're not on Social Security, then you must actively enroll yourself. So if you come across somebody who's not collecting Social Security and they're turning 65 years old, they have to actively enroll themselves. They have to know the rules. They're turning 65 and they have to figure out a way to enroll themselves into Medicare. Okay. When can they enroll? They know that they can enroll 3 months before your birth month, the month of, or 3 months after. Okay. Let me pull up something here really quick. Hold on a second. Let me pull something up. 1 second. Here we go. Okay. So we know that everybody gets a 7-month window to enroll into Medicare, right? They get 3 months before, the month of, and 3 months after to enroll into original Medicare. you're not collecting Social Security, you have to actively enroll yourself within these 7 months. Okay. Us as insurance agents, we're always going to encourage them to enroll the 3 months before. If we enroll at any time the 3 months before, then their Medicare is going to start the first of their birth month, right? But if they wait to enroll the month they turn 65, Medicare is going to start a month after, okay? But if they wait to enroll the month after they turn 65 years old, their Medicare doesn't start the month after, but rather it starts 2 months after that. Does that make sense? And every time you wait, it's going to stretch out longer. Does that make sense? So if they wait 2 months after they turn 65, it's not going to start the month after, nor the month after that, but 3 months later. That's when they're going to activate their Medicare. And so on. If they wait on the 7th month, 1, 2, 3, 4, 5, 6, 7, because we get 7 months to enroll into Medicare. If they wait, guess what? Their Medicare is going to start 3 months later. Does that make sense? Does that make sense to everybody, or does anybody have any questions about that? Do you guys know that?
And can you put that somewhere in the chat thing later or something? Because that is an awesome.
Yeah.
Easy explanation.
I'll
Thank
send
you.
it. I'll send it in the recording with the email that I send out.
Perfect. Thank you.
Hi, Carlos. This is Lee.
Hey, Lee.
Yeah, I have a client just this situation, and this month is the 7th month.
Mm-hmm.
1st April, she enrolled, but till now she haven't got a Medicare this number. What can we do?
When did you enroll? So
April 1st.
okay, so you enrolled April 1st.
Yes.
The Medicare card, it usually
Not arrived yet.
it usually takes about 3 or 4 weeks for everything to get processed and for them to have the Medicare card in hand. So it's likely coming in the mail sometime soon, right? But
Yeah.
you don't have to wait for that. You don't have to wait for the card to come in the mail, because
Okay.
you can call one of the insurance companies with all the
right,
client's information and the Social Security number and say, hey, I want to enroll them into one of your Medicare Advantage plans. And then you give them the social and you confirm their address, and then they give you the Medicare number that exists in the universe.
All right. Okay. I will double check. They decided to do the medical advantage plan already. So
Yeah, okay. So
they
if you
know
want to
which
enroll
company.
now, if you want to do it now, just call the insurance company, ask them that
Okay.
for the Medicare number, and that's it. They'll give it to you. The problem with them,
Okay.
the problem with them is that their Medicare is not going to start until 3 months later. If they signed up this month and they're in their initial enrollment period, this is the 7th month, then it's going to start May, June, July. July 1st is when they're going to have their
Should
Medicare.
be July. Yeah. But when I try to enroll through a website, they said it will start June. So I just confused. Why is not July? They only we only can choose June started.
Which May, June.
I think they want a blue shape cross.
Double check that. If you need some help with that, let me know. Get on my calendar. We can figure that part out. Okay.
All right. Okay. Yeah. I'll call
All
them
right.
today.
All
May I
right. So
mention something?
what was that?
I just want to share something. I had best results with United Healthcare Jarvis Help Desk. So you get this information in a chat while you are doing your stuff. You don't need to go on a call. So this is how I usually find out Medicare and Medicaid numbers. No need to call them.
Yeah. So let me show you what she's talking about. So I usually make a phone call to the producer help desk, but you can chat with them, right? So if you have your Jarvis login.
United Healthcare.
Yeah, United
I
Health.
prefer not to talk to people too much on the phone. It's so
Even the client doesn't choose this company, we still
Yeah,
can
you
call
have to
United Healthcare.
you have to pretend. You have to
Okay.
pretend like you're enrolling them into one of their Medicare Advantage plans or one of their prescription drug plans. They won't help you with the Medicare supplement. It has to be a Medicare Advantage or prescription drug plan. Okay. So
Alright, okay.
you go into here, Jarvis, you click on eligibility verification and you start chatting. They're gonna, verify your identity, and then you're gonna ask them, I'm looking for this Medicare number, and they'll give it to you via chat, as long as you have all the client's information. That make sense?
Alright, okay. Oh, yeah, good.
Okay.
Thank you.
Okay, going back. So how do you enroll into Medicare, right? We already know that if you're already collecting Social Security, you get enrolled automatically. There's nothing you have to do, right? Other way, you can call Social Security. If you call Social Security, they're likely gonna set up an appointment for you a month and a half from today's date to enroll you, okay? Or you can do it online, right? And this is where we help people do it online, okay? It takes about 15, 20 minutes to enroll into Medicare online, as long as, there's no hiccup with their citizenship or anything like that, right? What my suggestion is, if you have somebody who needs to enroll into Medicare, I would do this for them, because once you do this for them, it's like you've sold the policy already. They're not going anywhere. You're helping them with this. They're going to be your client for the rest of their life, right? So always take control of this stuff. So you can enroll in person, you can roll over the phone, or you can do it online. I would do it online for the clients with their permission to kind of hook them in. Does that make sense? Okay. Okay, so enrollment while working. What if I plan on continuing to work past 65 and not take Part B? So some employees will enroll into Part A and not Part B, where the employee health plan is still in force, okay? We know this, we get this all the time. People who are turning 65, who still have their insurance through their employer, oftentimes they want to keep the insurance through their employer. But what do we have to do? Our job is to compare everything. If somebody has insurance through their employer, we need to consider a couple of things. We need to see if they're better off going on Medicare or if they're better off staying on group. So some of these things are what we have to consider. We have to consider how much they're paying, what their deductibles are, what kind of co-insurance they have, their maximum out of pocket, co-payments, networks. These are all the things we have to compare, okay? Usually what I say to my clients is, when you're comparing like $1 worth of Medicare versus $1 of group health insurance, Medicare usually comes out ahead, okay? So if being on Medicare is gonna cost them, $320, and they have to pay $320 to be on their group health insurance, then almost always Medicare is gonna work out better. Because when you have Medicare, you have the red, white, and blue card as your primary insurance. You go wherever it is that you want to go, and you likely have a supplement, and all you have to do is pay $233 to cover any kind of doctor or hospital bills. And usually that's not the case with group insurance, right? Usually you have $3,000, $4,000, $5,000 deductible, $8,000 out of pocket, and all this other jazz. Okay, so when you're talking to somebody who still has insurance through their employer, these are the things you want to consider. Okay, but oftentimes people who are turning 65 and still have insurance through their employer, the only thing they do is they activate Part A. Why do they activate Part A only? Because Part A is free. They've worked here all their life. They've earned their Medicare credits. No harm, no foul to have another extra insurance that's going to help us with the hospital bills. Okay, but they don't activate Part B because that's the one that costs them $170 a month, right? So why would I pay $170 a month if I have this coverage through my employer, which makes sense. Okay, now this only happens when the employer has over 20 employees, 20 or more employees. This is the only time we're going to recommend that it's okay to only activate Part A and not activate Part B. Because if you have over 20 employees, then your group health insurance is primary and Medicare is secondary, right? So group is gonna pay first, and then Medicare is just gonna sweep up whatever they need to sweep up, okay? If they don't have 20 employees, then we're gonna recommend that they activate Part A and B. Because at this point, Medicare is primary and group insurance is secondary. So Medicare is gonna pay their part first, and then group health insurance is the one that's gonna sweep up the rest of the stuff, right? What happens if you don't have Part B and this is your primary insurance? Well, if your primary insurance doesn't pay, then your group health insurance, who's secondary, is gonna say, well, I'm not gonna pay either. Why do I have to pay if the first person didn't pay? You see what I'm saying? So it's very important to figure out the size of the employer when you're talking with somebody who's turning 65 and still insured through their employer. Okay, so again, over.
Can you repeat that, Carlos?
Sure,
Repeat how
so-
you said that, please. I'm sorry.
So again, if you have 20 employees, it's okay to activate Part A because group insurance is primary and Medicare is secondary, okay? But if the employer has less than 20 employees, you're gonna tell your Medicare client to activate both Part A and B because at this point, Medicare is gonna be primary and group insurance is gonna be secondary. If you don't have Part B in your primary insurance, then your secondary insurance is not going to pay for Part B services. They're going to say, if Medicare didn't pay, why do I have to pay, right? That's what they're going to be thinking, right? So again, over 20 employees, okay to just activate Part A. Under 20 employees, you got to recommend to activate Part A and B, okay? Now we've talked about this before. When should you not activate Part A or B? When you have group health insurance is when you're contributing to an HSA. When you're contributing to an HSA, you want to tell your clients, hey, if you're going to continue to contribute to your HSA, don't activate any part of Medicare. Do that later, okay? When they finally decide to retire, when they finally decide to retire, then you want to activate your Part B. You want to tell them, okay, call me before you retire, and we're going to do the paperwork to activate Part B. Okay. At that point, you'll have 6-month guaranteed issue window to sign up for Medicare plans once you activate your Part B. Okay.
So
ahead.
activation in Part B, what you said, it should be within 63 days, right?
Activation for Part B, you technically get 8 months, right?
8 months.
You get 6 months for a Medicare supplement, no questions asked, right? But you want to do everything before they retire because you want to get their Medicare Advantage in before 60 days. Okay. So if you're working with somebody who's retiring, try to get everything in place before they retire so that there's no hiccup in the situation. Okay. What if I plan on continuing to work past 65 and take Part B? Okay, if you decide to take Medicare, keep your, okay, so if you activate your Part B and you still have your group health insurance, and just remember that when you drop your group health insurance, you have a 63-day window to put everything else in place, right? To put your Medicare supplement in place, to put your drug plan in place, or to put your Medicare Advantage plan in place, okay? There are some situations where Parts A and B are enforced. Your employer's health plan will pay the remainder of the cost. Okay, yes. So again, if your employer is secondary and group health and your Medicare is primary, you can use your employer's health plan as secondary insurance. Okay. Retiree group health plans. If an individual is no longer employed and decides not to activate Part B, even though they have group health insurance coverage, they will receive a Part B premium penalty. We've talked about this plenty of times before. You have to determine if somebody is actively working or not actively working. If they're not actively working, you have to activate your Part B. It doesn't matter if you have COBRA from your health insurance, from your employer. It doesn't matter if they're paying, you know, the next 6 months worth of your health insurance because you've been such a great employee, so, with some sort of severance package. It doesn't matter. If they're no longer actively working, you want to tell them to activate their Part B, because if they don't activate their Part B, then this clock starts ticking. There's going to be a late enrollment penalty somewhere. Okay. Let me see what else. Okay, the Part B penalty. It's 10% every 12 months they went without their Part B. Okay, so what's the premium for Part B? It's $170.10 a month. Okay, if they went 12 months without their Part B when they were supposed to have it, then they're going to be paying 110%. They're going to be paying $187 for their Part B premium for the rest of their life. They're going to pay 10% penalty above that. If they went 15 months without their Part B, it's still a 10% penalty. If they went 18 months, 10%, 19, 20, 21, 22, 23, still a 10%, excuse me. Yeah, still a 10% penalty. But 24 months, now it's a 20% penalty. 25, 26, 27, 28, 28, up to 35%, it's still a 20% penalty. At the 36-month mark, again, it's now a 30% penalty. Does that make sense? Hopefully that makes sense. Okay. We talked about the things you have to consider. When does your Medicare begin? We usually say it starts the first of your birth month, right? The only caveat is that if you're born on the first of the month, then your Medicare will go into effect the first of the prior month. So here's an example. If you were born on December 1st, your Medicare effective date is going to be November 1st. Does that make sense? I don't usually bring this up with clients unless they're born on the first of the month, right? So I usually tell my clients, if your Medicare will always start the first of your birth month. Okay. Hopefully that makes sense. This is the red, white, and blue card. This is what we call original Medicare. It consists of Part A and Part B. Part A is hospital insurance. If we were to be formally admitted into the hospital, all the bills would be ran through Medicare Part A. Okay. Part A usually doesn't cost us any money because we've worked here all our life. We've paid into FICA taxes, and we've earned our Medicare credits. But let's say you haven't worked here all your life, then Medicare Part A has a premium. If you have 30 to 39, credits, 30 to 39 quarters, then your Part A premium, if you want to buy it, it'll cost you $274. And anything less than 30 credits, anything less than 30 quarters is going to cost you $499. That's $500. So when you're dealing with like immigrants that don't have all their full credits and Obamacare is too expensive, then they have an opportunity to buy Medicare at these prices. Does that make sense? How does Part A work? If all you had was the red, white, and blue card, okay, and you're formally admitted into the hospital, you have basically a $1,600 deductible. Let's just call it a copayment because that's what you're going to that's what you're going to lose when you're formally admitted into the hospital if all you had was the red, white, and blue card. Okay. If you're in there for longer than 60 days, then $389 per day for the next 30 days. If you're in there for the next 60 days, another 60 days, then it's $778 per day, right? Anything after the 150th day that you're admitted into the hospital, you're paying all the costs. That's why it's never recommended just to be walking around with the red, white, and blue card. If you're talking to somebody who just wants the red, white, and blue card and doesn't even want a Medicare Advantage plan, show them this. Listen, It's not recommended because this is what happens if all you have is the red, white, and blue card. Every time you go into the hospital, it's $1,600. Okay, so let's say I go into the hospital in January, and I'm in there for a week. I'm out $1,600. Okay, what happens if you know they let me go, but I come back 4 months later? How much am I going to have to pay? Another $1,600. What happens if they let me go and I come back 3 months later? Guess what? Another $1,600. It resets every 2 months. For each benefit period, we're paying $1,600. Does that make sense? Does anybody have any questions about that? That's why it's never recommended that you just walk around with the red, white, and blue card. Okay. Skilled nursing facilities. We know what kind of buildings these are, right? It's like, let's say somebody has a stroke, and they've been in the hospital for a few days, like over 3 days. Now they have to go to a skilled nursing facility to like do some therapy and things like that. Well, Medicare is going to cover the first 20 days, no problem. But the next 80 days, basically $200 a day. And anything after the 100th day, all the costs. Again, this is why it's never recommended that you just walk around with the red, white, and blue card. Okay, so that's part A. We know what it does. We know how much it costs. We know what our responsibilities are. Part B is medical insurance. I think about Part B as everything else insurance. Part A is just room and board at the hospital, right? But when your physician walks into the room, when the surgeon does surgery on you in the hospital, or when you go to a doctor's visit at his office, or when you go to an urgent care facility or get lab work, everything else insurance, outpatient services, is what we call Part B. And Part B has a standard premium of $170.10 a month. Everybody and their mama has to pay a standard premium at $170.10 a month. There's no way around that unless there's some financial aid we're getting to pay that, or we have to pay more because we're making pretty good money. And we'll talk about that here in a second. But everybody and their mama has to pay a standard premium of $170.10 a month. Okay.
I want something to be cleared, like in the hospital stay, if the specialty doctor walks in and checks you out, so that means you have to pay a copay there too for the specialty doctor.
There's going to be a charge for the doctor coming in the room. What that charge is going to be is depending on how Part B works, right? So you have to pay, the doctor services is Part B services, right? So you have to pay $233 first. That's your deductible. Anything after that, you guys are splitting 80-20. Medicare is going to cover 80% of the bill, and you're going to cover 20% of the bill. So let's do the math. If the doctor walks into his room, a specialist walks into his room, and his charge is $500. I'm just putting some numbers out there. The first thing you're going to have to pay is $233. Okay. That leaves us with a bill of $267. Out of that, we're paying 20%. And Medicare is covering the other 80%. So we've paid $233 plus $53.44 for that doctor's visit. When he walked into his room, we paid $286. Does that make sense? And then every bill after that, anything that's ran through Medicare Part B, we're paying 20%, 20%, 20%. And it's an unlimited 20%. So if we're getting $500,000 worth of cancer treatment, $500,000 worth of cancer treatment, and this is our first bill, we're paying $233 first, because that's our deductible. And then we're paying 20% of the rest, which is $100,000. Does that make sense? That's why it's never recommended that you just walk around with the red, white, and blue card. I'm talking to people who just want the red, white, and blue card and nothing else. Well, listen, let me show you what some of the financial exposures are when you just have the red, white, and blue card. I don't usually have to get into this stuff, but just so you're aware, here they are, right? Okay. So remember I told you that, oh, this is an old chart. This is an old chart, forgive me. Okay. Remember I said that the standard premium is $170.10 a month. If your income is limited, we can find Medicaid or the Medicare savings program to pay this for us. But what if your income is high? If your income is high, then guess what? You have to pay something called IRMA. And that just means you have to contribute more to Medicare. So if you're making anywhere between 91 to 114,000 bucks, your Part B premium is 238. Anywhere between 114 to 142, 340, and so on and so on and so on. If your income is above $500,000 then guess what? You're paying close to $600 for your Part B premium. This is a single person's tax return, and this is what it would be for a family. So if you're making over $750,000 a year, then this is going to be your Part B premium. Now, what they do is they look back at your tax returns from 2 years ago. So right now in 2022, they're looking at people's tax returns from 2020 to determine if they should be paying more for their Part B premium. Okay, if somebody retired and they're no longer making that kind of money, they're no longer making the $500,000, well, they can fill out this IRMA form and get the premium adjusted back. Where is it? Right here. Somebody comes to you and says, Carlos, they're charging me $500, $300, $200 and something dollars for my Part B premium. Why? Oh, it's because 2 years ago you made $200,000 or whatever the case may be. But Carlos, I'm not making that kind of money anymore. Okay, no problem. Fill out this form, send it into the Social Security office, and likely they will reduce you back to the standard premium. Does that make sense to everybody? Okay.
Hey, Carlos.
Yep.
Does Medicare refund that IRMA reduction if they find that their income did indeed go down?
No.
No. Okay.
I've never heard of anybody getting a refund for that stuff. It was,
Okay.
it's almost like, hey, it's your problem. You didn't let us know in time. We're not going to give you that money back.
Got it.
No? Okay.
Carlos, my client got succeeded to get adjustment for the IRMA.
Your client did get adjusted?
Yes, we talked about it a month ago.
Oh, okay, good, good. So they filled out the form,
Yeah.
got it all done, and everything was good, right?
Yeah, they sold the property building and they got
That's
a
right.
capital gain over $1 million. So they pay this it's highest, I think, IRMA price Part B, and they got adjusted now.
Okay, good, good. They didn't get their money back though, right?
I'm not sure. I didn't ask the money back, but in the future, he doesn't need to pay the extra.
Good.
Just basic.
Yeah, so likely they didn't get their money back. Okay. Anyways, okay. So how do you pay for the Part B premium? We already know that if you're collecting Social Security, you're automatically going to get enrolled into Medicare Part A and B. And they're going to say, hey, by the way, we're going to take our money straight out of your Social Security check. So they're going to take their Part premium straight out of your Social Security check if you're already collecting Social Security. If you're not on Social Security, you're going to receive a quarterly premium notice, a quarterly bill in the mail. And we've talked about this plenty of times before as well. The first time they get their bill, it's going to be 3 months worth or 4 months or 5 months worth, depending on where they fall in the Medicare billing cycle. I haven't figured out the science of that yet. Sometimes my clients get 3 months, 4 months, or 5 months. I tell them to be prepared for the worst, that you might get a bill for $170 times 10, times 5, times 5. That might be the worst case scenario. So you just prepare for it, okay? Is that right? 170, 10 times 5. Yeah. Okay. If somebody wants to, if that's getting too heavy for somebody, then you can always set up automatic drafts from a checking or savings account once a month. But you have to pay that first bill first. That first bill of 3 months, 4 or 5 months, that has to be paid, and it has to be up to date in the system, or else they won't let you set up automatic payments from your checking or savings account. Okay. And you do that from mymedicare.gov. Mymedicare.gov. You create an account here with your Medicare number, and in your homepage, there's going to be a button that says pay your premium. And when you get to the next page, it's going to say set up automatic drafts, or set up your pay easy form, your pay easy stuff, which means automatic payments. Okay, just in case you didn't know. Okay, so again, if it gets too heavy for somebody, if 3 months is getting a bill 3 months at a time is too heavy, then you can set up automatic payments, but you have to make that first premium payment first. Okay. Part B, excess charges. Okay. When you go to a doctor.
Carlos?
Yep.
So sorry, I just thought of something on that though. So in the case where an individual is, so if they're working, they're not collecting Social Security. So it's not like they have to call up and tell them, don't take anything, right? Or could they be?
Say that again.
I'm so sorry. So if they're still working, they're not collecting Social Security. So we never have to worry about them canceling something that would have automatically started if they didn't notify somebody in time, right?
Yeah, if they're not.
There's never an instance where you're.
Correct. If they're not collecting Social Security, they're not gonna get enrolled into Medicare automatically, and they're not gonna get a bill in the mail automatically.
Okay. And that's even if they're working just part-time.
Correct. If they're not collecting Social Security, no one's gonna enroll them into Medicare for them. The only people that get enrolled automatically is if you're collecting Social Security. That's it. So if you're working part-time, full-time, and you're not working at all, that's irrelevant. If you're not collecting Social Security, you're not going to be enrolled into Medicare. Right? So you have to actively enroll yourself. And then when you do, you're going to get the bill in the mail. 3 months, 4 months, or 5 months. You got to pay that bill off. And if you want to set up automatic drafts, go to mymedicare.gov, create your account, and set that all up. Okay. There's something called Part B, excess charges. Okay. There are 2 types of doctors in the Medicare universe. Doctors that accept Medicare payment as payment in full, which means they have a full Medicare assignment. And doctors who don't accept Medicare payment as payment in full, which means they don't have a full Medicare assignment. Okay. If I'm a doctor that accepts Medicare and I accept payment in full, then let's say I'm gonna get $100 for the service. That's what Medicare says I'm allowed to get paid, right? I'm gonna get $100 and then I'm done. If I'm a doctor that doesn't accept Medicare payment as payment in full, for that service, instead of getting $100, I'm gonna get $95. They're gonna penalize me 5%. That's what Medicare is gonna do to me. But then I can go turn around and charge my patient an extra 15% above that $95. So I can charge the client 95 times 1. I can charge that client $109, right? That 15% above what Medicare gave me is what we call excess charges. Okay. You want to understand what excess charges is because we're dealing with Medicare supplements, and sometimes we're going to sell a plan N that doesn't cover excess charges. Does that make sense? Does anybody have any questions about that? Okay. We know that folks have two primary Medicare options. They can go with option number 1 on the left-hand side, which is your original Medicare, your supplement, and a Part D prescription drug plan, or you can go with option number 2, which is called a Medicare Advantage plan. Okay. So with option number 1, with a Medicare supplement, you can basically go to any doctor or hospital anywhere in the country that accepts Medicare without having to have a referral, because your primary insurance is this red, white, and blue card. And we know that this red, white, and blue card, they say it's accepted at about 95% of all the doctors and hospitals, right? And wherever they accept the red, white, and blue card, they have to accept your Medicare supplement, okay? Medicare supplements, they come in all different flavors. They're lettered from A through N, with F, G, and N being the most popular one. F covers everything that the red, white, and blue card doesn't cover. The red, white, and blue card covers 80% of all the doctor and hospital bills, and F covers the other 20%, no questions asked. Okay. This is no longer available for folks who started their Medicare after 2020. Okay. Anybody who had Medicare before 2020, they can still purchase Plan Fs. The most popular one is the letter G. The letter G does everything F does. The only thing it doesn't do is it doesn't cover the Part B deductible. It doesn't cover the $233. So if your client has a Plan G, all they have to have is $233 in their sock drawer, and that's it. Medicare and the Medicare supplement cover the rest of the cost. That make sense? Okay. Plan N does everything G does. It still makes you responsible for the Part B deductible, but with Plan N, you have 2 co-payments, $20 to see your doctors and $50 to use the emergency room. And so after you hit your deductible, then you got to start paying those co-payments. Okay. The $20 every time you go see a doctor, or $50 every time you use the emergency room services and you're not admitted into the hospital. Okay. On top of that, Plan N, you're required to pay that excess charges. So if the client comes across a doctor that doesn't accept Medicare payment as payment in full, usually happens with specialists, then that specialist can charge 15%, and that's an extra 15%, and that's called the excess charges. And Plan N won't cover that for you. That'll be the client's responsibility. Okay. We don't need to go over that. Okay. When I'm showing Medicare supplements, I'm showing them from my Medicare Center, right? I'm going to medicarecenter.com. I'm clicking on my CSG quoting tool. This is where I go for Medicare supplements, the CSG software that is inside this Medicare Center. Okay. I'm going here. I'm clicking on Premier first. I want to only see the supplements that where we have connections with. I'm clicking on Medicare supplement. I'm putting in a zip code, putting in a county. I'm putting in an effective date. Somebody's Medicare might start May 1st. And I'm looking at a Plan G. And I'm doing a screen share with my client, and I'm showing this stuff. One, it gives them a level of like trust, right? Because I'm here, Mr. Client, can you see my screen? There are a bunch of companies that are more than willing to sell us a Medicare supplement Plan G, okay? What I'm supposed to do as your insurance agent is I'm supposed to recommend one for you. I'm supposed to recommend the one that's affordable, that's popular, that has a lot of people on the books. Because if it's popular and it has a lot of people on the books, imagine if one person got sick in that pool of people, the insurance companies have a much easier time spreading that bill amongst a lot of people than it would a smaller group of people, right? So what does that mean? That means that the rates of increase over time tend to be less than the rest, right? We're not fortune tellers. We don't know how much they're going to increase over time. We just try to make the right choice up front, right? And I show them this, right? So I'm going to tell them, hey, I recommend whatever I recommend, right? And then I tell them, okay. So John, let's call the client John. Let's take a moment to shoot the big pink elephant in the room. There are usually three things that people have on their mind when I'm showing them these Medicare supplements. Now, the first thing they think about is, I must have to pay a fee to use Carlos and get his help with all of this. The answer is that that's not true. We don't charge anything. We don't charge anything for our service. We get paid a commission anytime we sell you any one of these insurance companies. They're going to pay us a commission. Okay, we don't charge anything for our service. The second thing they think about, they think, well, nobody works for free, so the insurance company must charge a higher price if I go through Carlos, if I go through you, right? That's also not true. You pay the exact same price whether you go through me or if you go to the internet universe and find all the different carriers, you'll find the exact same prices. The insurance companies are more than happy to not to pay us a commission if you want to go do this on your own, right? But they're going to pay us a commission to educate you on all this stuff. That's all they're going to, but you don't pay a higher premium. Does that make sense? And then the last thing they think about, they say, well, if you get paid by the insurance companies, you must have a bias towards one company or the next. That's absolutely not true. We're going to recommend one for you because of the reasons that we said, because it's affordable, it's popular, it has a lot of people on the books, we have experience with them, and they have good customer service, right? We're going to recommend, let's just say Manhattan Life, right? But if you tell us you want to go with Joe's Chicken and Waffles, then guess what? We're going to go with Joe's Chicken and Waffles because you're the boss. This is your policy. If you tell me you want to go with Blue Cross Blue Shield because you're just in love with Blue Cross Blue Shield, guess what? We're going to go with Blue Cross Blue Shield because they're going to pay us the same. Does that make sense? I tell the clients. So I always go over those three myths. I always, okay, let's shoot the big pink elephant in the room. We don't charge anything for our service. You get the same prices if you want to go to the internet universe and find them. And you're the boss. You tell us which one you want to go with. We're just going to make the recommendations, right? And 99.99999% of the time, your client is always going to go with the recommendations that you recommend. Does that make sense to everybody? Okay. Does anybody have any questions about that? It's 12 o'clock. I don't want to take up too much of your time, but you know, there's a couple other slides that we want to go through. Maybe we'll go through them next week. We can go over how prescription drug plans work. You know, this is a whole another training in itself. Part D prescription drug plans. Maybe we should go over this next week. Okay, we'll go over that next week. We'll go over the Part D penalty. Does anybody have any questions about some of the stuff we talked about? Are there any questions in the chat? Okay.
Great stuff, Carlos. Thank you.
These were some basics, right? This is some Medicare 101 basics, but does anybody else have any questions about this stuff? Or any scenarios that they want to go through? Any questions they had with some clients that we can talk about at the moment? No?
Carlos, I have a question.
Go ahead.
Like one of the client, he was asking, can we calculate the Social Security benefit according to the annual income?
I think you can do that, but you have to know, you have to go into their Social Security account and see what their income was for the many years that they worked. And maybe you have to pick out the top 5 of them and plug them into a calculator somewhere and they'll be able to figure it out. But those kind of questions, I would direct them to Social Security, honestly.
I did the same thing. It's not my expertise.
I mean,
so
it wouldn't be a bad idea to learn how to do it because
yeah, I want to learn though, but
because being a Social Security expert they're like, people want like more of those kind of helps. Like if you notice any of the YouTube videos, the ones that have the most views are the ones that are where you're talking about Social Security, not about Medicare. You know what I mean? So getting well versed on Social Security and how it all works, and maybe even taking some courses and getting a Social Security like designation to your name or something like that, that would be a good idea. I know they're out there because a couple of the people that I met have some of those like Social Security designations at the end of their name. You know.
So how should we answer that question? Sometimes clients are okay.
At this moment, if you don't know how to calculate it, then just say here, the best thing to do is to call Social Security and ask them. They have all your numbers. They have all your income from prior years. They'll be able to determine what your Social Security amount will be. I don't. Or you can I think you can easily log into your SSA account, and I think it'll tell you right there. I think it'll tell you like if you retire now, what the amount of money that you'll be getting. I think it's right on the homepage.
Okay, let me try because I haven't tried. There are some clients who want to know, okay, what will be my benefit? How much I will be.
Log into the Social Security account, and I think it'll be on there.
The other question I have, somebody has worked 10 years, like 10 years before turning 65. So still they can get a Medicare?
They worked 10 years before they turn 65? No.
No.
You have to be 65 years old to have Medicare. Or you have to be on Medicare disability.
He is turning 65 this year, but he stopped working for 10 years now. That means he worked till 55.
Yeah. He's fine. As long as he's worked 10 years.
It doesn't matter.
Throughout his whole life. It doesn't have to be the 10 previous years. It can be, he started working at 16 and stopped working at 26. That's it. 10 years, we're done. We've earned our Medicare credits.
Nice.
That makes sense?
Thank you.
Okay.
Carlos?
Anybody else?
Carlos?
Yep.
Okay, so only because this was an actual client that I had. Otherwise, I'm sure you'll cover this going forward, but it kind of stumped me and it spun stuff around in my head. The client originally, when he came to me, he was like, I don't want Advantage plans because I don't like them. I want to go supplement, but I'm pretty sure I'm going to be Medicaid, blah, 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 blah. Then turned out they applied and he did not get it. So for now, he wants a supplement. So I've got him on supplement. But one of the things that he said to me that was spinning in my head is, he said, if I'm on Medicaid, which they told him he'll get approved once he officially retires, because he works for himself, he's a trucker. He said to me, why would I need anything else if I've got Medicare and Medicaid? And in my head, I went, that can't.
You're breaking up, Chrissy. Did Chrissy break up or am I breaking up? You guys still there? Because I'm breaking up. Are you guys still there? My internet went crazy for just a second. So Chrissy, I think I heard you.
Yeah.
I think you said, why would somebody need anything else if he has Medicare and Medicaid at the same time, right?
Correct. He is under the impression if he's got those two, he's got nothing to worry about. And I really wasn't sure what to tell him.
Yeah. What you tell him is this, and let me see if I can say it the same way somebody said it last weekend.
Okay.
I'm going to give you everything you have now and then some.
Okay. So you do get extra benefits if you do.
I'm going to give you all the zeros, right? You're still not going to pay anything for your Part B. You're still not going to pay anything for all your services. You're still not going to pay anything for anything. You're going to have all these zeros, and then you're going to get more. Does that make sense?
Yeah, but it's because of the extra benefits you get with an Advantage plan, right?
Sure. So that's the way he said it. That's the way he said it. He said, I'm going to give you everything you have now, all the zeros, and then some, right? So
I like that because when I did try talking about like dental and hearing vision and hearing benefits, you know, he was like, no, I don't need any of that stuff. That stuff's too expensive. I go to East Europe when I need that stuff. And I don't know what you would do in a case of an emergency. That's an expensive dentist visit, if you ask me, but whatever.
Sure. So you're really going to
Okay.
give them everything they have right now and then some. Okay. So, okay. That's a word track on how to sell, how to convince them, right? But what do you know?
Yep.
We know that when you have the red, white, and blue Medicare card, you can use that thing all over the country, right? However, Medicaid is not going to follow you, right? All over the country. Your red, white, and blue card will, but Medicaid in Illinois will not follow you for services that you get in California. Does that make sense? Right?
Yep.
So,
okay.
if you're the type of person, okay, so we know that part for sure, right?
Yep.
We know that if he has a Medicare Advantage plan, like a PPO plan, and he goes all over the country, at least he'll get some benefit from his Medicare Advantage plan. Does that make sense? He still won't get credit for his Medicaid that he has in Illinois, but at least if you get him a PPO plan, he can get services across the country with just the Medicare Advantage plan. Okay. When you put somebody into a Medicare Advantage plan, you want to make sure that their Medicaid doctors are in the network as well, right?
Okay.
And yeah, I guess just the extra added benefits, right? Like,
When I do have some time with this, because for now he did go supplement, and he did it completely based on price. So he went with N. And so then he said, once he decides to quit working, then Medicaid said they would be approved and they would be, so I obviously would like to be able to keep him, you know, and still have him. And so I want to show him the benefits of that. He seems to do more out of the country traveling, if anything. I know the daughter he'll visit, but out of the country is his biggest. He goes to Eastern Europe, he says.
sure. And how much does Medicare cover outside of the country? How much does the red, white, and blue card cover outside of the country? Like, let's say he's in Eastern Europe.
Nothing.
That's right. How much does a Medicare Advantage plan cover outside the country? That depends on the plan, because now Medicare Advantage plans are offering coverage internationally or foreign coverage. Does that make sense?
So I should look at that up ahead of time.
So that can be a selling
point
point too, right? So you can find a Medicare Advantage plan in his area that's potentially offering that has, you know, foreign coverage, and maybe you can say, hey, listen, at least with this you have some coverage outside.
Okay, I like that. Thank you.
Which plan does
I don't know
cover
which
the
plan.
foreign-
You have to do some research. All I know is that Medicare Advantage plans are now starting to offer the same benefit that a supplement offers, you know, like $50,000 outside of the country.
Because one of my
Can I-
clients was asking about the foreign travel too. She wanted to know.
You have to
the-
do your own research. You have to look at the plans that are in the area and go to the summary of benefits and figure out if there's some sort of foreign coverage on there. Look up the word international or look up the word foreign in the summary of benefit and see if it'll tell you.
Okay, let me, if I may, share some experiences I have with immigrants and foreign travels with regards to original Medicare and Medicare Advantage. Original Medicare still covers emergency. Always remember the word emergency for any of the plans. It's all over the country, all over the world. It's a question of how easy it is to get reimbursed, okay? Because normally they will not bill them. There's no billing system from one country to another. So in Medicare Advantage, if you look at the summary of benefits, for most of the major providers like the United Healthcare, the Humana, and all these major ones, you're going to see a line item that's under emergency. So they do cover emergencies, whether it's HMO or PPO outside the country. So I had one client, an Indian client, had a knee surgery locally in US. And then he went on a travel to India. He has a Humana HMO and his knee got infected. So he WhatsApp back and said, what am I going to do? I said, just go into emergency, make sure your bill says emergency, okay? So he has to pay first because there's no billing or reimbursement. He pays first and then he comes back. I helped him to connect to the claims department and they reimbursed him minus the copay. So the copay, depending on providers, are generally $90 or $120 for the major companies, okay? So again, like Carlos says, you want to do your research. So in his case, he just got his claims back and minus the copay, which is very, very reasonable. You know, you go in a foreign country, you go into emergency and you only pay $90 copay. In his case, it was 90, I can't remember, 90 or 120. So it works that way. So the client needs to know they have to pay first if they're on an emergency outside the country, and then come back, do the claims, and then minus the copay with the Medicare Advantage. I've never had anybody on a original Medicare or on a Medicare supplement that's in that scenario, so I can't speak for that. But according to the notes everywhere they write, they put a benefit that it does cover emergency. So I only iterate what they say, but in the Medicare Advantage, I know it works. So when I talk to like your case, Christy, your client who is going to be on a Medicare, Medicaid, true, locally, if you're within Illinois, you are all set, okay? You go to find a network of doctors that takes Medicaid, and I can tell you more and more doctors are not taking Medicaid. So at least you have the option of a specialist that's not outside the network of Medicaid and pay your little copay and you get the best quality of care. But outside of that, you, like Carlos says, you travel nationwide or you travel internationally, you have a Medicare Advantage that gives you that, like you say, the $0 and more, you know, and that's the more part that the Advantage will take care of. I hope that helps. Yeah.
That does. Thank you very, very much. I wouldn't have even thought to touch on this with him. So I appreciate both you guys. Thank you.
Thank you. Thank you. It
So
makes sense.
Medicare, so in general, Medicare won't pay for healthcare or supplies you get outside of the US. The term outside of the US means anywhere other than the 50 states of the US, just blah, 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 it's not, right? When does Medicare cover healthcare services in foreign hospitals? Well, there's 3 situations, right? And these are the situations. You're in the US when you had a medical emergency and the foreign hospital is closer than the nearest US hospital, okay? When you're traveling through Canada without unreasonable delay, through Canada, when you live in the US and the foreign hospital is closer to your home than the nearest, so this is when Medicare will pay. But for me and my general knowledge is that they're not going to pay. So we can put this into I can email this out to people. I just Googled, you know, does Medicare cover outside of the US? And this is what popped up. Okay. Okay, well, it's 12:15. I'll let you guys go. Remember that if somebody on the team that wants to go to 8%, I have a ticket for you. Let me know if you want to take advantage of one of that ticket. Come with me, enjoy some company and enjoy the speakers. Maybe it'll change your life. Maybe it'll hype you up. Okay, so just let me know and call me if you need me or make an appointment on my calendar. Always there for you guys. Okay.
Thank you, Carlos.
Talk to you guys later.
Thank you so much, Carlos.
Bye-bye.
Thank you.
Carlos.
Thank you, Carlos.
Thank you.
Bye.